Trauma incoming. Multiple GSWs. SEAL team casualty. The military hospital explodes into action. Stretchers rushing. Medical team scrambling. A Navy SEAL covered in blood crashes through the doors. Dr. Patterson, the lead trauma surgeon, starts barking orders. I need vitals. Blood type. Get me. But the wounded SEAL grabs his arm, pulls him close, whispers something that makes Patterson go pale. What did you say? The SEAL's eyes lock onto a blonde nurse in the corner. Nurse Emily Carter, organizing medical supplies like it's a routine day. You need her. Patterson looks confused. That's just a nurse. I need my trauma team. But here's what changes everything. The SEAL grips Patterson's arm harder, blood seeping through his fingers. You don't know who she is. I know she's a nurse. She's a doctor, trauma surgeon, former Air Force. Patterson stares at Emily, then back at the SEAL. That's impossible. She's been working as a nurse here for 8 months. Check her file. Real one. Classified section. Wait until you see what happens next. Patterson pulls out his secure tablet while his team stabilizes the SEAL. Enters Emily's personnel number. Accesses the classified database. What loads makes him step back from the operating table. Dr. Emily Carter, Major, United States Air Force. Combat trauma surgeon. Deployments, 7. Lives saved in hostile conditions, 243. He looks at Emily, still calmly organizing supplies. Why is a combat surgeon working as a nurse? The SEAL coughs blood. Because 12 months ago, she lost a patient during surgery. Patient was her fiancé, told the copyright. Here's where the truth comes out. Patterson reads deeper. Finds the incident report. Captain Michael Torres, Special Forces, sustained critical injuries during extraction. Emergency surgery performed by Major Carter. She tried everything, the SEAL whispers. Every procedure, every technique. Operated for 9 hours straight. He died on the table. He died in her hands. But here's what makes this more than tragedy. After that, she resigned her commission, requested demotion to nurse, said she couldn't trust her judgment anymore. Patterson looks at Emily. She's noticed them talking about her, maintains her professional distance, continues her tasks like the conversation isn't happening. We need her, the SEAL says, blood pressure dropping. I've got internal bleeding the monitors aren't showing. I can feel it. She'll know where to look. I have a full trauma team if they're good. She's better, and I don't have time for good. Here's where Patterson makes an impossible decision. Nurse Carter, I need you in surgery, now. Emily doesn't look up. Dr. Patterson, you have a full surgical team. That SEAL specifically requested you. He's confused from blood loss. He told me about your Air Force service. Emily's hands stopped moving. That was a different person. Doctor, that person saved 243 lives in combat. That person also killed someone she loved. But here's what happens next. The SEAL's vitals crash. Monitors screaming. Patterson's team rushes to stabilize. We're losing him. I need to get him into surgery. The SEAL grabs Emily's wrist as she passes. Please, you're the only one who can find it. Emily looks at his eyes. Sees something. Find what? The bleed. Lower right quadrant. Feels like it's behind something. Your team won't see it on imaging. Patterson checks the scans. There's nothing on the cord, because it's retroperitoneal. Emily says quietly, behind the abdominal cavity. Standard court won't show it clearly. Patterson looks at her. How do you know? Because I've seen this injury pattern before. Afghanistan. Same mechanism, same symptoms, same misdiagnosis until it was too late. Here's what you need to understand. Emily's not guessing. She's recognizing a specific injury that killed 3 soldiers before she learned to detect it. An injury her fiancé tilde copyright didn't have. An injury she knows intimately. If I'm right, he has maybe 20 minutes before he bleeds out internally. And if you're wrong, then I'm still just a nurse and your team handles it. Patterson makes the call. Get him to OR3. Carter, you're scrubbing in. Doctor, I'm not credentialed. You're credentialed as of right now. That's an order. Major. What happens in the next 30 minutes becomes hospital legend. Emily transforms the moment she enters the OR. Not gradually, instantly. 12 months of hiding vanishes. The combat surgeon emerges. Scalpel. Her first incision is precise, confident. Nothing like a nurse pretending to be a surgeon. Everything like a surgeon who's done this hundreds of times under worse conditions. Retractors. I need clear visualization of the retroperitoneal space. Patterson watches her work. You're moving like you've done this recently. I practice every day in my head. Every surgery I couldn't do. Every life I could have saved. You're not just maintaining skills, you're improving them. Guilt is an excellent teacher, but here's where her experience shows. There, bleeding from the inferior vena cava posterior wall, exactly where imaging couldn't see it. Patterson looks at the monitor. How did you know? Because the last time I saw this injury, I didn't check. The soldier died on my table. I spent 6 months studying every detail of why I missed it. Emily's hands move with precision that shouldn't be possible after a year away from surgery. Clamping, suturing, repairing damage that would challenge any trauma surgeon. Bleeding controlled. Starting repair of the vessel wall. Patterson notices something. Your hands aren't shaking. They haven't shaken since Afghanistan. Even when your fiancé told the copyright, especially then. My hands were perfect. My judgment was wrong. Here's what you need to understand about that statement. Emily's not suffering from poor surgical skills. She's suffering from survivor's guilt. Her technique was flawless when Michael died, but flawless technique couldn't save injuries that were beyond saving. 27 minutes later, the seal is stable, bleeding controlled, repairs complete, vitals strong. Patterson steps back from the table. That was exceptional work. Major, that was the job. Doctor, that was more than the job. You found an injury that my entire team missed. You would have found it eventually. Eventually he'd be dead. Emily removes her surgical gloves. One save doesn't erase one loss. But what Patterson reveals next changes her perspective. Major Carter, do you know why that SEAL knew to ask for you? No, doctor. Because 3 months ago, his teammate was brought here with similar injuries. You were on shift as a nurse. You told the surgical team to check for retroperitoneal bleeding. Emily remembers. They found it. They found it because you caught what imaging missed. That SEAL survived because of your experience. I was just a nurse making a suggestion. You were a combat surgeon saving a life from the nursing station. Here's where Emily faces her truth. Dr. Patterson, I let Michael die. You tried to save injuries that were incompatible with life. The after-action report says he sustained damage to multiple organs. No surgeon could have saved him. I should have done more. You operated for 9 hours. You tried procedures that weren't even in the textbook. You did everything possible. Everything possible wasn't enough. It never is when the injuries are that severe. But what Patterson shows her next proves his point. He pulls up Michael's medical records. Major, look at the injury assessment. Trauma to liver, spleen, major blood vessels, and cardiac tissue. Any one of those injuries is potentially fatal. He had all of them. I'm aware. Then you're aware that no surgeon in the world could have saved him. You gave him 9 extra hours. 9 hours for his family to say goodbye. 9 hours that other surgeons wouldn't have achieved. Emily stares at the records, seeing for the first time what grief prevented her from seeing a year ago. The board cleared you. Your commander cleared you. But you didn't clear yourself. Because I'm the one who was holding the scalpel when he died. And you're the one holding the scalpel today when the SEAL lived. 3 weeks later, Major Emily Carter stands before 20 military surgical residents, her nurse scrubs replaced by surgical attending uniform, that combat surgeon status restored. My name is Major Carter. 1 year ago, I lost a patient on my operating table. That patient was my fiancé told the copyright. The residents shift uncomfortably. I'm going to teach you what I learned from his death, and what I learned from the 243 lives I saved before that. For 16 weeks, Emily transforms 20 residents into combat trauma specialists, teaching them not just technique, but judgment under impossible pressure. This is a retroperitoneal bleed. Imaging will miss it. Your hands have to find what the machines can't see. She shows them Michael's case, the injury pattern that killed him. This is unsurvivable trauma. Standard teaching says keep trying. I'm teaching you when to stop. When continuing surgery only prolongs dying instead of enabling living. She teaches them the hardest lesson in medicine. This is the difference between saving a life and torturing a dying patient. Your job isn't to prevent all death. It's to prevent preventable death. On graduation day, Patterson addresses the class. Your instructor didn't just teach you surgery, she taught you wisdom earned through loss. But here's the real test. 6 months later, 3 of Emily's residents face critical trauma cases. One has retroperitoneal bleeding that imaging misses. One has Michael's exact injury pattern. One has survivable trauma that requires immediate recognition. All 3 make correct calls. The retroperitoneal bleed is found. The unsurvivable patient receives comfort care instead of futile surgery. The survivable trauma is treated successfully. 2 lives saved. 1 family spared watching futile procedures. That evening, Patterson finds Emily in the surgical suite, not hiding in the nursing station. Teaching another resident, 3 of your students faced impossible cases today. Emily looks up. Results, 2 lives saved. 1 family thanked us for honest compassion instead of false hope. The unsurvivable case, your resident recognized Michael's injury pattern, provided 12 hours of comfort care instead of futile surgery. The family was grateful. Here's what you need to understand about that outcome. Emily's teaching didn't just save the 2 survivable patients, it saved 1 family from the trauma of watching doctors fight against biology until the patient died from the surgery itself. Major, will you keep teaching? As long as there are surgeons who need to learn the difference between fighting for life and fighting against death. Remember Emily Carter when you see someone hiding their expertise because they're carrying the weight of an impossible loss. Real healers don't stop healing because they encountered unhealable injuries. They learn to recognize the difference. Emily never stopped being a combat surgeon. She just needed to understand that Michael's death wasn't surgical failure. It was injury incompatible with survival. Treated by a surgeon who fought until the very end. With the SEAL who lived because she recognized what others missed, and residents who learned that the best surgery sometimes means knowing when not to operate.